Christy.
Okay, thanks a lot, Constance. Well, every year, approximately 130,000 people in their reproductive years are diagnosed with cancer. In the fight against the disease, many are left infertile and unable to conceive and have babies. But with the help of experts, many young cancer patients are finding ways to preserve their fertility and their dreams of one day having a family. Mary Cook Martel was just 34 years old when her doctor discovered a lump in her breast and sent her for a mammogram.
To my surprise, the fast word is I had breast cancer.
Although surgery, chemotherapy, and radiation were all necessary, the young newlywed was fearful about how all that would affect her fertility.
I was actually more confident about getting past the cancer. I was more nervous about how are we going to have a family.
The spotted embers are right here. Okay.
Mary turned to Dr. Moshe Perez, a fertility expert who helps both men and women preserve their fertility prior to undergoing cancer treatment.
Well, with men it's pretty easy. I mean, you just obtain the sperm and you count the sperm, make sure the sperm count is adequate, and you freeze it. You do a couple of those and at least you keep it in the bank and it can be kept there indefinitely.
We told him at Thanksgiving, so that was like a big surprise.
For women, the process of collecting eggs requires using hormones to stimulate the ovaries, which also carries a risk for cancer patients.
There are certain protocols we use in which we're using anti-estrogens. Instead of just stimulating the ovaries using anti-estrogens that also have a stimulatory effect on the ovary to produce eggs, but actually achieve much lower level of estrogen.
Once the patient's oncologist gives the all clear, the ovaries, eggs, or sperm can be unfrozen for implantation.
But many times a decision the woman makes because there's no doctor who can guarantee to her that she's not going to get a recurrence of cancer.
2.5 years after treatment, Mary's oncologist recently gave her the green light. She went through one in vitro cycle with the eggs harvested prior to her cancer treatment and is now pregnant with twins.
I'm elated. I mean, my husband and I, we waited a long time, and our friends know, and everybody couldn't be happier, and the fact that it's twins was an added bonus.
And another option for women who receive chemotherapy is a hormone that actually puts those ovaries into a temporary menopause. Doctors can surgically relocate the ovaries to protect them from radiation and all that kind of treatment.
It was one man's last trip.